Premenstrual dysphoric disorder is often missed or misdiagnosed. Here are the criteria for premenstrual dysphoric disorder. Now, the symptoms have to occur leading up to your period, and the symptoms have to start getting some relief once you start your period. And that's what makes it different than other conditions, is that it's around the period and the menstrual cycle. In order to meet criteria, one of those symptoms has to be related to mood or affect. So this could be things like sadness, irritability, heightened anxiety. So they have to be related to your emotional state. And those symptoms could be either your mood going up or down, feeling irritable or angry, feeling sad, or feeling anxious. So it has to be one of those symptoms. In addition to one of those symptoms, you have to have 4 other symptoms from this list. Decreased interest in things that you once enjoyed, fatigue, poor concentration, changes in appetite, changes in sleep, feeling overwhelmed or out of control, and physical symptoms. And the physical symptoms could be breast tenderness, bloating, joint pain, or weight gain. So you have to have one symptom from the first list having to do with emotions, and at least one of the other symptoms from the list that I just read. And you have to have at least 5 total symptoms from the entire list. Now, these symptoms have to cause significant impairment or distress, and they can't be caused by something else like another medical or psychiatric condition or from a substance. And you can't just have a one-off situation where you have these symptoms. You have to at least mark them over 2 menstrual cycles. Typically, people get relief from working with an OBGYN and a therapist. They may get treatments such as an SSRI, which is a selective serotonin reuptake inhibitor. They may also be treated with hormonal contraceptives, and also things like ibuprofen or things to ease the physical symptoms. And sometimes treatments that are therapies like mindfulness-based therapies and somatic therapies, as well as talk therapies, can be very helpful. It's important to think about these hormonal fluctuations because there are studies that show who are more prone to having PMDD may experience similar mood shifts with other periods of vulnerability having to do with their hormones, such as postpartum depression, and when they're going through perimenopause and menopause, they may struggle. So knowing your history and knowing that you've had this in the past may help you to prepare in the future. So how can you tell if you have PMDD? Start tracking your symptoms. Use a notebook and rate your symptoms on a scale of 0 to 10, and try to keep track of your period manually and look for these problematic symptoms. Also, try to track what helps and what hurts your symptoms. Are there certain things that make your symptoms worse? Like, are you not getting enough rest? Are you not eating foods that will support you? Are you under a lot of stress? Try to figure out what worsens your symptoms, how severe they get, and what helps your systems. Did you learn something new in this video? Let me know in the comments below.